specially packaged to bring you health information, and of course, we also make sure that you know the possible or nearest point where you can access treatment, how to go about it, and in case of emergency, who do you reach out to? Welcome to another beautiful day on your health. I am your host, Lucy Erickson of Chunago is my name. It's a beautiful day to talk health. Basically, we know that when we talk about our sense organs, we primarily we are looking at the eye, the nose, the ear, the mouth, and of course our skin. These help us to know we are still living because you need your nose to breathe, you need your mouth to talk and also to take in things, you need your ear to hear and your eyes to see and mirror a whole lot of beautiful things that we can appreciate. All right, today we'll be looking at taking one of these sense organs to elaborate everything that we need to understand about how to go about hearing. Now, if you're on the road, you need your ear to know there's a vehicle behind you. If you're even at home, you need your ear to know if there is danger around you. And so it is very important that today we have brought our specialist. Today we have Dr. Mike Ikoko, consultant ENT, that's the ear, nose, and throat doctor, and also the head and neck surgeon. Dr. Mike, good to have you on our platform.
Thank you.
You see, I was just feeling like, back to school. our basic sense organs. Yes, nose, ear, mouth, and of course the rest, the skin.
I will add to it now.
Truth. Leave the truth. Is it because you are the throat surgeon here?
Yes. So I will just make it the 5 now.
The 5.
Okay, the sixth one.
The sixth one.
5B.
5B. Okay. We'll consider that that will be for the academic medicals. If you approve it, we'll have it included. All right. Today we'll be looking at the ear and hearing care. Many people don't even think it's necessary to care for any part of their body specifically. They just think when you talk about care, you bathe, and that goes. Then for the mouth, you brush. Every other thing takes care of itself because God have taken care of them. So, but medically, people have come to make us understand that every part of the body, the organ need to be taken care of properly. So, the ear, when we talk about hearing, is it just you talk, I hear? That's what we can define as hearing.
Basically, hearing, of course, is the primary means of communication. So as you're talking, I hear you and I respond. It becomes troubling when you talk, I don't hear. And then it could be frustrating. And that's why if you notice that those who are deaf tend to be aggressive.
Okay.
Yes, because of that frustration that people are talking, I can't hear what they are saying.
I only know this person.
So that is the problem. And we'll find out that over the years, hearing and hearing loss now has become a problem. So when you don't hear, we are now looking at hearing loss, which may now range from the one who someone maybe will call hard hearing to the person who is deaf.
Okay.
Deaf is on the extreme of the ladder.
Okay.
For us, we'll say somebody who is deaf or deaf mute now has what we call profound hearing loss. While those who have hard hearing are from mild to severe.
But
so
you need to talk loud.
you need to either talk loud or shout for them to hear. Now, it's been noticed that hearing is becoming a problem globally. Yes, and that is why WHO has made efforts to ensure that the public, there's this awareness concerning caring for the ear and hearing. It's estimated that by 2050, 1 in 10 persons will have a hearing problem. Yes. Presently.
Why?
Because
The noise of population.
Noise
Pollution.
pollution, primarily, or majorly. Also, we found out that for those 1 in 3 people above 65 years have hearing problem. And then half of those above 75 have hearing problem.
Above 65?
1 in 3.
1 in 3, okay.
Yes. Above 75, half of them have hearing problem. So for those sets is age related. And then of course about 2%, 2 in 1,000 children will have hearing problem at birth. So you now find out that it's a common thing. And then the preventable ones, we want to see how things can be done to prevent the preventable ones. The preventable ones will include noise related. And then 2, those that are from drugs. But some of the drugs we use and abuse, especially in our country where you can get antibiotics and other medications over the counter. Of course, prompt treatment of certain illnesses that can affect hearing. So the awareness now, the drive now is to see how much we can concentralize our people so that at least they will be aware of this problem and then how to go about it preventing
So,
it.
in other words, a whole lot of there are whole lot of incidents that could actually lead to hearing loss.
Yes.
It could be your own making, some,
course.
and others, medical incidents.
That's
and
beyond
then
your
the rest.
control.
Okay, because in treating one, you buy one, and that could be hearing loss. But why those drugs? Some are even prescribed. Now let's just take a case of where the medication is not even abused. It was used as prescribed, and yet this individual is experiencing hearing loss.
Yes, there are some certain drugs that can cause hearing loss. Now we look at some of our anti-malarials that we were using that were in the market before now, the quinine, the
Yes,
chloroquine.
I know that very well.
Patients who are on chemotherapy, can have hearing problems. Some of the antibiotics can also. However, there should be always a balance. Things like gentamicin and all, if you notice, is being discouraged its use. And then even as a clinician, before you give it, it's expected that the patient's renal function should be normal. So the person is able to make urine and all. There are parameters to look. And then sometimes for like the chemotherapy too, you now find out that you are weighing two. It's like standing between the devil and the deep. So you have
should
to
I use
should I use the chemo now or I shouldn't and allow the cancer to continue? So somehow you now find out that certain times you may strike a balance. However, the problem we have majorly are those that can be prevented. You see people go over the counter, Gentalab, and it's even cheap. The way we get eardrops and then you just start pouring into the ear.
Because the ear is paining me.
Yeah, but of course.
I'm aching.
But you see, using it wrongly, the abuse is our problem. And of course.
Also, there's a prescription on the packet, at least 1 or 2 drops should be able to do what.
But they'll say, see your doctor.
That's after 3 days.
No, not after 3 days.
Okay, so in other words, Dr. Mahia is saying before you use certain medications, certain drugs, even over the counter or even when prescribed, you must stick to the prescription so that you have been properly diagnosed. Then you can use. As often, most of this medication could end up giving you a hearing loss. I use my money to buy a problem.
Yes. Now, even watch the alarming one now is even the noise.
Noise.
Yeah. You see, we are noisy people as a race or as a people.
We are noisy or we are healthy, lively people?
No, we are noisy people. Because it is not want the music to be at the highest. So if I'm in the church,
I can enjoy it.
Okay.
And I have to show my neighbor I have this system.
Thank you.
My neighbor needs to know I've bought this
Yes,
system.
and I have a party. People around must know that.
No, I'm partying now.
And then if we're doing night vigil, people around should not sleep.
That no
So that
church is here.
So those in my church, at some point I had to get a sound meter, so that I'll be able to control the music, the noise from come worshiping with brethren, worshiping God with brethren, and then going home with a hearing loss over time. So you find out that there are levels of noise or sound that is comfortable to the ear. And that's why if you see those working at the airport, at the tarmac where the plane lands and take off, you see them with ear muffs, protective muffs, because the plane makes about 120 decibel in measurement of sound. The trailer horn is 90 decibel. The trailer horn. And can you believe that in my church at some point we were getting 100 decibel in the church?
From the instrument.
From the speaker. So that means we were also within the fire while they are singing or talking, you have a trailer horn on your ear. Then not to talk of the younger generation. These days now we talk about earphones, headphones, and all the names they call them.
And they need to keep it to
Of course.
And
And some,
they are using it to calm down.
and then the
to
volume,
relax.
the volume is at its peak. You even horn while you're driving and they don't hear you. You need people to tap the gentleman hand. So there's a car behind you. Those are noise. And you see, so it's every day. Look at, if you see those who grind pepper, it's a little illustration. If you go to Bogonogo,
Yes.
anybody who walks in that session and you meet the person and you interact with the person without shouting, ask that person, when did you start this business? I will assure you that anybody who have done that business for at least 6 months, you must shout.
6 months.
At least 6 months. You must shout at the top of your voice.
Just not like seriously, not even 6 years, not for years.
No, I said 6 months. You will have to shout at the top of your voice before the individual will hear you. Because a daily exposure to noise. And so if we're able to control some of these things, it will go a long way in reducing that number. And of course, in reducing those who will become disabled from hearing and then may need rehabilitation. Because it's also costly to rehabilitate those with hearing problem.
Rehabilitation.
Yes.
As in, like, I know we need rehabilitation for people who do drugs.
It could be depressive that people are talking, you can't hear them, especially someone who was hearing before. That's a corner. Then rehabilitation, as I mean, is helping them to hear. So there are
Okay.
rehabilitative devices, like the hearing aid,
now
cochlear
I
implant.
was wondering, have I
If we have to open another saloon in Asaba.
Yes, to just set out to rehabilitate our
Okay,
hearing
no, no,
loss.
no.
Okay, just some devices to help
Then
aid.
hearing.
Okay, if you're just joining us, is the program Your Health, and today I have Dr. Mike Okue Ikoko in the house. He's a consultant surgeon, ear, nose, and throat, and of course a head and neck. Now I got head and neck surgeon. Okay, from the Federal Medical Center here in Asaba, and we're looking at taking care of the ear and hearing loss. And he has made us to understand that a whole lot of things, a whole lot of indices could lead to hearing loss, such as loud music, loud horns, even speakers in the church, wherever you find yourself, and there are lots of noise exposure, you could actually end up with a hearing loss, as well as some medications that are prescribed and some that we prescribe for ourselves. Okay, now we've looked at drugs as an indication to hearing loss. We also have noise pollution. Now, can one be born with a hearing loss? I'm not talking about being born deaf. Can one be born with a hearing loss?
Yes. You know, I mentioned earlier that 2% of
But yes, now I get it.
2 out of 1,000
Of babies. Yes.
are born with hearing problem. So some of them may be deaf. There are certain things that could lead to deafness before birth, while the baby is still in the mother's womb. And that's why in certain countries where things work, what they do is that when babies are born, there's a hearing test done at the labor room. Yes, it's done by the nurses in the labor room. So those who pass, they will allow them, they will go. Those who fail the test will be subjected to further tests. So that if they would need rehabilitation, it will commence before they get to the age where they can talk.
All right. If they need rehabilitation at infancy, more care will be given. At this point, we'll take a break. When we come back, Dr. Mike is still very much around. We'll just stay. hearing, ENT, head and nose surgeon from the Federal Medical Center, is here today to enlighten us on the importance of staying away from noise pollution, as well as avoiding unprescribed drugs, and even when medications are prescribed, to use as prescribed. And of course, also see your doctor immediately when you have a hearing challenge. Okay, now I also use this opportunity to say thank you so much to the NMA at Sabbath Zone before they withdraw my doctors. I want to appreciate you all. Thank you so much. Without you, Dr. Mike won't be here talking to Rose today. All right, Dr. Mike, let's go back. We've talked about um, most of the courses. Now, how do I check as an individual at home to know that I'm experiencing a hearing loss? What is this thing that will spike me to say, move, you need to see a doctor? Okay. For me or for my child or for people around me?
You know, we just mentioned a few causes of hearing loss. There are
others.
Yes, even things like wax, the common wax we bring out from the ear. Okay. Yes, that brownish stuff can also give us hearing loss. The other infections and the rest of them can.
Okay.
So how you can know? Sometimes you see that parents will come and say, "Oh, this is my child." When you call, he's not responding, or you have to shout. That's an indication that, oh, there's need to look at that ear. Sometimes also it may be, oh, when people are talking, I seem not to hear what they are saying very well. Or I will have to tell them, say it again, you know, they will have to repeat before I'll hear. That also is actually an inkling to say, oh, this person needs the ear or the hearing system to be checked. Then there could be pain. Sometimes also they don't just, because these things don't come in isolation. There could be other complaints also. Sometimes some people will tell you, oh, I have pain in the ear, or I'm hearing sound. It's as if something is making noise inside my ear. Sometimes also they tell you, I sit down and it's like the environment is stunning. You know, there are different complaints. So they can just complain to their doctor. And after looking at it, some of them will say, okay, oh no, this one you will need to see the ENT specialist so that you can have a proper evaluation.
Okay, so you've actually mentioned the WAS, and now that brings us, I know there was this conversation I had with you some time ago, and you said we shouldn't be cleaning the ear. And now you're talking about the WAS. That means we also need to remove the WAS.
Yes. Now, wax, first there are natural ways wax can be removed. Like I don't know, maybe I would have mentioned it then. If you look at the ear, there are hairs that help trap dust. So they beat out gently to remove the wax. That is one. Even as we are talking and chewing, you know, the ear is just behind the jaw. Yes. So that also helps dislodge some of these things, and then they come out. So those are natural mechanisms that have been put in place by nature to help take care of the wax. It becomes a problem when we start using cotton bud or whatever, the cotton bud, the Q-tips, yes. Because you find out that when you are putting it in, you push those ahead inward, and then before you know, you get the wax stacked in there. That is one of the reasons why we discourage it. Then secondly, also you plug those ears off, so that function is lost. Then you can injure the ear, creating a wound, and then which may become infected.
I'm not saying that we should just leave it, because sometimes it looks unsightly.
No, it comes out on its own. Now, when the wax comes in now, there are methods to remove the wax. Okay. First, we use fat-soluble solvents.
Like?
Things like olive oil. Almost every home in this our neighborhood have olive oil. We pray with it, we use it to anoint ourselves, and it's just dropping it into the ear. And it will dissolve.
Not with the aid of the cutting board or
no. Just
not
2-3 drops.
Not even our chicken feeder, because we
No. It's the tickling you are interested in. I don't think it's wax you want to remove with the chicken feeder.
It's very, very nice. Like this feeling.
That's the tickling we are talking about now. So that olive oil can. Then of course, there's sometimes when you come into the clinic, the hospital, there are instruments you can use to remove. Okay. The idea is as you are removing, you are looking, you are seeing what you're doing, not like a blind thing. So there are certain instruments we can use to remove the wax. Or better still, we can syringe the ear. We flush the wax out.
Okay, now I know there's this friend of mine, or let's say relative. I know that if you're standing close to him and you're talking to him, from the right side, it doesn't seem to get you. But if you move to the other side of the left ear, any slight noise from that side, he picks. On this side,
So it's
how can one ear
possible.
be deaf and the other is not?
No, it's possible. One, it could be wax that is in that ear. It's also possible that yes, he would have had some ear infections on that ear, either as a child or in the past, which has damaged that ear. It could have been trauma too. Maybe either a fall, a slap, or an ROTA or something that affected that ear. So it's
ROTA, what's that?
road traffic accident.
Okay.
So I think you will advise him to see the doctor.
He's old now, like
Yes.
60.
Yes.
And this has been on for like, since I knew
It gets worse with aging because there's also age-related hearing loss. You know, I said 1 in 3 people around 65 years will have hearing problems, and half of those above 75. We call that age-related.
So it's possible for one to be.
So that also may complicate the already existing problem.
Okay, now, generally, what would be your advice if I have to care for my ear? How do I go about it? I don't have to come to the doctor's office all the time to clean.
Yes. Now, the first is that we're saying caring for the ear is awareness, like we're doing now. People should know that there is need to care for the ear. That is something we expect, that we should all know that yes, this ear is an important organ also in the body that needs to be taken care of. Then two, there are the preventable causes of hearing loss, of hearing issues. Now, that will now say, okay, let's avoid them. I talked about loudness. Because it's something we see is the most common cause these days. Before now, it used to be infection. But with antibiotics and all now, ear infections are relatively on the background now with noise coming up. And of course, the use of earpiece, earplugs, and what they call the names they give them. Those are things that, or at least we should ensure that the volume is not so loud. And even when you watch, if you're using a good earpiece, sometimes there's a volume you get to the warn you that you don't have to go beyond. But when you insist, they are like, but there's a warning on your phone. All these things are actually from the manufacturers to help prevent hearing loss. So we should avoid those ones. And then two, medications should not be taken without prescription. As much as possible, we should avoid self-medication. Then also, the insertion of objects, cotton bud and the rest of them.
Please don't mention my feather.
At least those are things that we should avoid. And then it's okay, if you notice any complaint with the ear, seek help early.
Okay, early visitation or early help, as much as you can get, will help minimize hearing loss or leading to permanent deafness. Avoid using unprescribed drugs. Stick to the medications you are given. Like the doctor has said, early presentation will help with early treatment. And then the noise, please take down the noise and help your environment. Help yourself as well as your ear. Dr. Mike Ikoko, thank you so much for coming on our platform today.
Thank you.
And once again, thank you to NMA Asaba Zone. Until then, avoid noise, take care of yourself. And for the Gen Zs, watch the use of your headphones. Stick to the decibel that is permitted. Until then, God bless you. Salute.